Good evening, everyone. I hope everyone can hear me okay. I'm going to take that as a yes. Before we begin, I'd like to acknowledge the traditional owners of the lands on which we all meet and pay my respects to their elders past, present and emerging. My name is Natasha Sakira. I'm a medical registrar from Toowoomba currently. Everyone will hear me say this at least once. It's Tash, just Tash. Please no Natasha. Today, I'm really excited to be hosting this webinar. This is going to be super interactive. We have three amazing doctors who'll be addressing mental health and well-being for really specifically doctors in training. Following the discussion, there'll be plenty of time to ask those burning questions, and you can input those along the way through the Q&A function on Teams. If you don't know how to use it, just give us a yell. But without any delays, let's introduce our speakers today, Dr. Elise Witter, Dr. Kim Jenkins, and Dr. Sabrina Davidson. So Elise and I go way back actually now. Elise is a stage 3 psychiatry trainee currently completing her advanced certificate in consultant liaison psychiatry. She's deputy chair of the AMA Committee for Doctors in Training and is passionate about doctor wellbeing and reducing stigma. Kim is a consultant psychiatrist with clinical expertise in consultant liaison psychiatry and psychotherapy, currently in private clinical practice. Kim is also founding member and board chair of Hand in Hand Peer Support. Sabrina is a consultant psychiatrist with lived experience of mental illness. This has grown into a passion for destigmatizing mental illness among doctors and supporting mental well-being among health professionals. So, let's begin. Oh, Elise, I'm sorry. First off the banks, the early years in a doctor's career are often some of the most demanding. Certainly, I've experienced the same. From your perspective or experience, what do you think makes this period particularly challenging for mental health?
Sorry, classic, you were muted moment. I think there's lots of contributors for doctors in training. We're essentially the workhorses of the hospital and clinical services. And yet, despite having so much clinical responsibility, there's very little autonomy. You essentially have to do what you're told by consultants. We're subject to the hierarchical factors. And it's a very busy time juggling the demands of clinical practice with training demands, trying to do research or further skills to get onto your desired training program. So I think there's a lot of demands and yet not a lot of autonomy or self-direction. And I think that can cause a lot of moral injury as well for doctors in training.
Absolutely. And Kim, you were just reflecting on the fact that you're transitioning towards retirement now. I guess that's a really different perspective. And I wonder what your thoughts are about that particularly early period in a doctor's career.
Oh, gosh. I don't want to end up being one of those people that says, when I was young, it was like this, or when I was young, it was different in my day. But I think it was different in my day. And I think in some ways, it's a lot tougher to be in those early careers now and a doctor in training now than it was when I trained. And I think, one of the basic differences, and I think Elise has sort of touched on it, the sort of a lot of responsibility, a lot of expectations on doctors in training, but not much autonomy. But I think one of the things is like the increased expectations with a digital age, with everything being on a fingertip and electronic sources and everything, to be across everything all at once. And I know when I was, in those first few years of being a houseman, a senior houseman or a registrar in the UK, you didn't get your results until the end of the day. And so if you didn't know somebody's blood rhubarb level, you'd say, I'll get it at 5 o'clock this afternoon when the results come in. But now I think there's increasing expectation that doctors in training are across everything all the time and have everything at their fingertips. But that's just one of the things, and I could probably spend the whole extra hour and a half saying why I think it's more stressful now than it's used to be. But I think that that need to be constantly ahead of your game. And we're all sort of type A personalities in medicine, and the pressures we put on ourselves to be that person and how much we beat ourselves up when we don't achieve that is makes us all very vulnerable.
Absolutely. And honestly, it is so refreshing to hear a consultant say it is harder now than it was in my day. I am so happy. And Sabrina, you have lived experience and are so open with it. I wonder what your thoughts are about this early period in a doctor's career.
Yeah, I mean, I second Kim's thoughts around expectation. There's that a lot of the expectation from the community and other people and our patients that we are the health experts. We need to know everything. We need to have all the answers. And that's really, really hard as well. And that type A personality, that perfectionistic traits that can be really adaptive and helpful as a doctor, but at the same time, it can cause, I know in myself, I am a perfectionist, openly admit that. And, I quite often, even now, still have the anxiety or fear of making mistakes or wanting to please my superiors or please my patients. And the other thing that I did experience in my training time was that sense or that expectation that you have to be the strong person for your patient, that you have to be stoic and you have to be calm all the time, and being unsure or being a bit anxious is actually bad, and it means that I'm incompetent, which is absolutely untrue. And like Elise and Kim mentioned as well, that responsibility that you have as a doctor, we have that strong sense of responsibility to save lives, to reduce the suffering that our patients are going through. But we can actually forget that bad outcomes can happen despite our best efforts. And I think that's one thing that, we always want to do the right thing and fix our patients, even though sometimes that bad outcomes do happen. And, as in one thing that I did feel as a psychiatry trainee and even now as a consultant psychiatrist is that you become the holder of the patient's most fragile times, and that is hard. They share with you their darkest fears, their deepest secrets and trauma, and whilst being the person who has access to all of this is a privilege, it's also a massive responsibility. And finding work-life balance was really tough when I was starting off. Sometimes I wonder whether it actually exists, work-life balance. But I do remember when I was an intern and a stage 1 trainee or a first year trainee, I was so enthusiastic. I was, very excited. I took extra on calls. I worked late, and I think reflecting back on this, I felt like I wanted to show people and myself that I'm dedicated and capable. And in the end, my life part kind of didn't dwindle away. So finding work-life balance, I think, was hard for me at the start of my training years.
Absolutely. And that's such a good point. Work-life balance at the moment to me seems like a mythical unicorn. It comes and it pops in and it pops out. I'm hopeful that the unicorn will stay one day. You mentioned something during your response that I found particularly poignant at this point in time in my work week. So I'm day 11 of 12 and I'm tired. We've had 7 patients start on the care of the dying and all have passed away in that pathway. And it's particularly emotional because we all sort of join medicine because we want to save lives, but it's now quite a flipped perspective to support someone's transition to passing away. And that's been quite confronting for me. And I've been picking up on the signs that I clearly need a break and probably an extra wine. And that was the sign for me. As well as my husband saying, do you need to have a nap? Is it time for a nap? He's right, it was time for a nap. But I wonder, Kim, do you have any small or early signs that you think we should pay attention to, both in ourselves and our colleagues, that it's maybe time to seek support?
Can I put you really on the spot there? Because when I was working with the Victorian Doctors Health Program, I used to do a lot of these sort of talks about looking after yourself, what to look out for. And I actually have a slide that it's okay to enjoy a glass of wine, but when that I want a glass of wine becomes I need a glass of wine,
Absolutely.
It's time to sit up and listen, girl.
Exactly.
That is a warning sign. And so you are reading the signs right if it becomes I need rather than I want. I think, so what am I talking about? I'm talking about sort of warning signs that it's time to help. Oh gosh. Late warning signs are dreading going to work in the morning, feeling really tired, you don't have to be totally burnt out. I have a colleague who was a GP who told me he was feeling a little singed around the edges rather than burnt out. And I thought, singed around the edges. And he meant he was just sort of like, not necessarily dreading going to work, but he just wasn't looking forward to it. And he had previously been somebody who really enjoyed his work. I think, and sometimes, we all have phases when work's not going through a good phase, it's not fun or it's not nice. But if that's prolonged, then seek help. And if you know yourself well, and I'm not sure that many of us do, if your usual coping strategies aren't working, time for some extra help. If you find that any sense of doom and gloom goes beyond a critical incident and starts spilling over into the rest of your life, if you, as you said, we may all have adverse outcomes for our patients sometimes, but if feeling bad about what happened at work starts to feeling bad about other things and spilling over into the rest of your life, time to get a bit of help and extra support. And I have a whole long list of other things as well, but there's a few to go on with.
Absolutely. And Elise, do you have any signs that you've noticed across the years in yourself or among colleagues?
Well, absolutely. Something that I've noticed within myself and that I'll follow up from what Kim said is not necessarily dreading to go to work, but normally I'm quite jovial and I bring a very positive attitude to work, make lots of jokes in the tea room. And I notice what's an early warning sign for me is that if I'm feeling irritable or grumpy at work, or if someone asks me to do something and instead of me feeling like, yeah, sure, I just feel a sense of irritation and annoyance. That's usually a sign for me that things are heading in the wrong direction. And in terms of colleagues, something it really struck me a few years ago. I had a very severe episode of depression. And things got to the point where I would only have a shower or brush my hair if my partner prompted me. And I'd show up to work late, 30 to 45 minutes late every day. Sometimes showered, but rarely with my hair brushed. And none of my colleagues, which was ironic because I worked in mental health, none of my colleagues were like, "Are you okay, Elise?" But I think if you're noticing people that their self-care is starting to slip, or that they're normally, I have to be honest, I'm not normally punctual, but I'm normally only 10 minutes late. If 10 minutes late is stretched out to 45 minutes late and the self-care started to slip, that's a pretty good indication that you need to tap your colleague on the shoulder and ask them if they're okay.
Absolutely. Recently, my Instagram feed has been motivational, you need to go to work, girl posts. And I was like, is that a sign? Sabrina, have you noticed anything?
I guess for me, it's when things start to slip for me, it would be that irritability. That's one of my early signs that I'm starting to relapse or burn out. And the other thing that I do is not that I dread to go to work, but I start to do more work. I become anxious about work, and I start to check my emails on my days off. I check my patients list on my days off to prepare for the next day. So I start to overthink, or work becomes, or think about work constantly, and not in a positive way either. I become actually quite anxious about it. I'm a creature of habit. I have quite a, structured routine. Wake up in the morning, go for a run, have my breakfast, go to work, come home, do a hobby, sleep routine, all that. I'm a creature of habit. But if one of those things start to slip, that is one of my warning signs that if I start to go, nah, don't feel like a run this morning, or nah, I don't feel like picking up the fiddle and play some music. Those are the small things. The one thing my husband does say that, what does it look like when I start slipping backwards, is that I don't look like a dolphin anymore. So it's a bit weird. So apparently I have this, I don't have a rest, my resting face is a dolphin smile. So he says that he notices if that dolphin smile on my resting face is not there, then he knows that, oh, something's going on. So yeah, and so those small things that sometimes you don't realize are happening, and sometimes it's really helpful to get feedback from others about how you're doing, and just as important as giving feedback to other people about how they might be going as well.
Absolutely. I'll
chip in there, because I think you've touched on an important point there, that sometimes it's other people that see we're not traveling too well, or realize we're not traveling too well before we realize that ourselves. But that doesn't mean they're always going to tell you. And there comes the difficulty in that, I can think with shame of colleagues. I've wondered if they've not been traveling too well and maybe not done anything about it because you feel embarrassed about asking, or you don't want to interfere, or you don't want to, feel them to feel even more uncomfortable than they might already do. And we can make all those sorts of excuses to ourselves for not sort of tapping our colleague on the shoulder and going, "You traveling okay at the moment? You don't look like your usual, as happy and chirpy as you usually do." And I think, as personally, we're all very good at denying what's going wrong with ourselves, pretending it's not happening, wishing it wasn't happening, and carrying on as though it wasn't happening, that either consciously or unconsciously. Sometimes we don't notice those things ourselves, of our own mental health going down. So it's really important, especially if you've had a past history of episodes of poor mental health, to have a look at the early warning signs for you as an individual with your relapse and your relapse signature, and have them maybe sort of documented somewhere, and a trusted observer that can say, "Hey, you look like you're going down that pathway again." And it might just be as, you usually sleep 8 hours and it's really hard to get you up in the morning, but you're only sleeping 6 hours now or something. Or it may, everybody's sort of relapse signature is different, but trying to identify what slipping into poorer mental health looks like for you, and having somebody on your team that can help you spot those things is good.
Absolutely. And I'm really happy to say that I see the dolphin smile tonight. So I think we're good right now.
I think that is the most gorgeous thing, a dolphin smile.
Yeah. I guess you've touched on a really important point, Kim, in that it's sometimes really hard to broach that question about, is someone okay? And I wonder, sometimes people have disclosed to me that they're not feeling okay, but they're afraid of seeking support because they're worried about what the ramifications might be, or what even to do as the first step. what would you suggest to them?
Is that back to me?
Yeah.
So, do something. and you mentioned earlier, or you implied that you're working in palliative care at the moment.
No,
How many?
general medicine.
General medicine. Okay. All right. Well, assumption is dangerous, but we're very well aware of our patients having advanced care plans. I rather sort of, so I don't, not meaning to sound sort of facetious or joking about this, having your own care plan, having a list of who your GP is, who your mentor is, who your peer supporter is, who your dentist is, and who other relevant health practitioners are in your life or supporters, or the numbers of doctors' health services or other people that can help doctors, having a ready-made list of those things and keeping it somewhere. It doesn't have to be pinned on your fridge like the address and phone number of the plumber or anything. It doesn't have to be a fridge magnet, but have it somewhere. And, you know, hopefully you will never need it. But when you do feel unwell, that is the worst possible time to go hunting around to find a good GP. So having that list of where you could go to, if this happened, I would contact this person and their number is this. And you might not even need it for yourself. You might need it for a colleague or a friend. But having this almost like advanced care plan worked out. And I'm not sure I've particularly answered your question very well, but
Absolutely.
I think thinking ahead, that if you look around us and you look at us as medical practitioners, we have a much higher rate of mental health problems compared to the general population. It's naive to think we're not going to need help sometime in our lives, in our careers. So let's all, you know, step one is let's all be a bit proactive and get the resources lined up, ready if we do need them.
Absolutely. And Elise, do you have any things you wish you would known earlier in taking that first step, or things you had thought about at the time but weren't sure how to address it and have now worked through that?
It's a great question. I think for me, I've always been very fortunate in that I've been very proactive in having a GP. And when I did become unwell, I already had an established relationship with my GP. But I remember even then there were so many barriers to seeking help. And I think a part of the issue is that when you're already in, you know, a negative frame of mind, or you're already experiencing mental ill health, you obviously have that tendency to catastrophize. And so it was like, oh, you know, what if people see me as less competent as a doctor? You know, what if my GP reports me to APRA? What if, you know, this happens or that happens? And it's quite interesting. You look into the studies, and Marie Bismarck, someone who's done a paper on this, the experience of doctors who've been subject to a regulatory process by APRA. And the common theme is that they put off getting help until things got to the point where, because they were fearful of the ramifications, and then things got to the point where they came to the attention of APRA anyway as a consequence of not seeking help. And certainly, I think it's an important take-home message that if, you know, you are having a mental health challenge and seeking help, you're not the person who APRA is worried about. They're worried about the people out there who are insightless and not seeking help, and becoming impaired that way. And I think another thing that I experienced as a barrier was just a sense of self-stigma, particularly being a psychiatry registrar. You know, I was like, oh, have so much knowledge about mental health, but I'm just not quite managing to implement it into my daily life. But yeah, I was very fortunate to have a GP who I had a great relationship with, and I think, you know, obviously everyone needs to have their own GP as a doctor, and there's so many other services out there. You know, there's the employee assistance programs, Doctors Health Advisory Service, your NGOs like Beyond Blue. So there's lots of doors that can be open to you once you start looking.
Absolutely. I remember when I moved states and was finding a new GP, I just booked in an appointment just to chat. I didn't have anything to speak to her about. And she was like, I'm confused. Why are you here? I was like, I'm just here so you can get to know me. And now she is the best GP I've ever had. And she loves it when I come in, and she knows when I'm clearly having a problem. And Sabrina, I guess I wondered, did you have some fears or assumptions ever about seeking help, or was that more comfortable?
I guess for me it was probably slightly, not a lot easier, because I had my first episode when I was in med school. So I had gone through therapy and treatment for a number of years before I became a doctor. But that doesn't mean that it was all easy to seek help, because I did have that, like what Elise mentioned, that self-stigma of, you know, I'm a doctor, I should be strong, and I shouldn't be sick because I should be the healthy one. And when I became a psych reg in my first year and had my relapse, I was also had that self-stigma. Well, I'm meant to be the psychiatry expert. Yeah, I can't get a psychiatry expert, but I can't get sick. You know, it just didn't gel in my mind. But one thing that you mentioned, Tash, that was seeing a GP. I think that was one of probably the most important things I did when I first moved to Townsville, where I've worked for 15 years now, is to get a GP and just get to know them, build that trusting therapeutic relationship with them. But it's not just your GP. You know, if you can find someone at work, your supervisor, your director, a mentor, and someone you feel comfortable being transparent about your health is really important. What else? I guess one thing that I did find hard to remember when I became unwell was actually reminding myself that my own health, mental health, is just as important as my patient's health. You know, I can't be there helping my patients if I'm not well, you know. And I, you know, looking back, despite, you know, having had therapy and treatment before I became a doctor, I wasn't very aware of my own early warning signs in my early years as a doctor. So I just pushed through and eventually relapsed again. And so I do agree with Kim. Formulate a relapse prevention plan or an action plan. If you do, you know, it's when you're sick, it's so hard to think. It's so hard to organize things. You can feel so amotivated, tired. Your concentration's pretty poor, and it's going to be a huge challenge to try and find a doctor, find a psychiatrist, find a support person. So having all that ready to go is really good. And also actually maybe sharing that plan with someone you trust and someone who knows you.
Absolutely. I think that's such a good point. It's not just about you knowing where those resources are, about someone else being able to help you when you need it.
Yeah.
I guess an important point that you brought up was seeking a support person in your workplace if you felt comfortable. I found that a lot of doctors in training often feel like there are aspects of their workplace or training program that they can't change, and then that impacts their mental health and well-being. I guess given the reality of how sometimes strict workplaces and training programs can be in terms of particular requirements, situations that may not actually fit with the doctor in training's, say, out of work life, is there a way or a practical way of addressing that for doctors in training to protect their own mental health and well-being during training? Do you think, Sabrina?
So you mean like if there's issues that's beyond your control that
Absolutely. So
yeah.
I guess, for example, for a lot of female medical professionals who are inclined to have a child, that can be quite tricky to manage through training programs. That's one aspect, but there's plenty more I could think of.
Yeah, I guess that I mean there's a lot in life that you can control or influence, and there's a lot in life that you can't. And it's the same with health systems. You know, there's and sometimes it's important to remember that no system is perfect. And we do our best with what we have. It kind of reminds me of, not sure with the audience and yourselves are familiar with the circle of control, circle of influence, and circle of concern by Stephen Covey. So it's basically three circles that overlap each other. So the middle one, the innermost circle, is the circle of control, and these are things that you do have direct control of. You have control of your responses, your behavior, what action or you might take to fix something or improve something, or how you might react to something that's happened. Then you have the second ring outside of that, which is a circle of influence, where things that you can't directly control, but you still have a level of influence on. So things like, I can't, when I have a relapse, I can stop myself from relapsing. Things happen, but I can do my best to improve my health. So those kind of things. It can be other things like relationships, another colleague's performance, for example. Then you have the circle of concern, which is the outermost ring, where these are the things that bug you, that worry you and bother you, but you don't have any control, influence over it. So I guess, it could be things like, the national state budget for healthcare. You don't have any control over that. You kind of have to just, okay, we get what we're given and we do our best with what we have. Or the pandemic is something that we couldn't control from happening, but what we could control was how we responded to that pandemic and how we worked through it. So I guess it's about remembering that you can work on, when the system, when there are things in the system that doesn't work for you, that you don't have any control of. It's being able to sort of, I don't know whether letting go is a good way of saying it, but actually turning your focus more on the things that you can control and influence. And I think that will actually make you a lot more, feel a lot more productive and happier and more calm and less anxious, I think. Yeah.
Absolutely. I've actually never heard of the 3 circles before, so I'm going to use that. So
Yeah.
remember to credit you.
I usually give my patients 3 boxes. I'm much more simple, and I just give them a box that I can control this, I can influence this, and whatever I do is not going to make any difference to what's in this box. But I think, even though we can have circles, we can have boxes with problems that are affecting us, For external things, sometimes it's those things things you've got no control over, your concern circle, or whatever I do, it's not going to make a bit of difference about this. Those are the things that can tip us over the edge because they make us feel so helpless. Okay, we have a choice whether we feel helpless or not, but when we're feeling unwell, we're going to feel helpless. And when we're stressed out at work with overload and on the edge of burning out, it's sometimes those things that you've got no control over tip that burnout into depression.
I really had an experience with that last year. And I guess I'll split my response into two parts. Sorry, Kim, I hope I haven't interrupted
No,
you.
go for it.
The first part is, I think it's one of those, change the things that you can and accept the things that you can't. But personally, I found, particularly as an intern and doctor in training, experiencing and witnessing the problems within the healthcare system, I found it very empowering to, join the AMA and work in different advocacy spaces and feel like I was part of a solution. But leaning into what Kim said about sort of feeling helpless at work, I had an experience around this last year when I was working at the Royal Adelaide Hospital. And I had a very busy rotation and then a lot of out of hours on call, which went till 11 p.m. And I love my sleep. So finishing up at 11 p.m., which realistically was more like finishing up at midnight and then getting up to go back to work early the next day, just wasn't a vibe for me. And I really struggled with the on-call space because of the way patient flow procedures worked there. We would have 20 to 30 patients in ED waiting for a mental health bed at any given time. They wouldn't even see a psychiatrist, some of them, the whole time they're in ED. There would be a lot of use of restrictive practice, putting people under the Mental Health Act, using physical restraint to manage them in ED. And I found it really distressing going to work and working through this on-call list of patients who weren't seeing psychiatrists, weren't getting good care, and it caused me so much moral injury and distress. And I became very burnt out and depressed during that period. And I went to see my GP and talked to my GP about it. And my GP was like, just don't do it. Like, if it's causing you this much distress, just stop doing it. Like, it's too harmful for your well-being. And wrote me a note to say that I'd only do one on-call shift per month on a weekend, so that I didn't have that late night, early morning issue, and that, I just wasn't exposed, because it was pretty much weekly we'd have an on-call shift. And I think just the accumulation of the exposure to the situation that was causing me the distress was really challenging. And I felt really guilty, and I felt guilty and awful, and I felt like I was letting down the team, and I was worried that my boss would judge me. But I could also see where my GP was coming from. And in the end, I did the old self-compassion trick and said, well, what would you tell a friend in your situation? And of course, I'd tell them, have the time off, don't participate in the on-call roster. And so that's what I did. I just started doing one on-call shift a month on the weekend. And when I started doing that, I stopped feeling so distressed about what was going on at work, and feeling like I was complicit, I suppose, in a system that was potentially harming patients. And not being in that situation really improved how I was feeling. And it also improved my ability to function at my 9 to 5 and my regular job, because I wasn't so distressed with what was happening in the on-call space. And I feel like often, doctors, like we've said, we're also type A, we're reluctant to take, accommodations, or, get off the on-call roster, or, right out of night shifts if you're going through a difficult period. But, you can't sacrifice your well-being to keep the health system functioning. Like, that's not your job at the end of the day. And I think, once I accepted that help from my GP, I was like, oh, actually, this is fine. And no one has even noticed I'm not on the on-call roster. And if they did, no one really cares. So I think, if there is a situation like that where things are really difficult, it's okay to remove yourself from it if you can.
Absolutely. I was once working in a system where on the weekend, you would only have to do it once every 3 months, the full weekend. And it was technically rostered from 7 a.m. till 1 p.m., but it was 7 a.m. till 10 p.m. And I put my AMA hat on and I was like, what would I tell someone who came to me at the AMA and said, this was happening, what should I do? And so I wrote a beautiful email and essentially said, I would rather do 2 weekends, though I finish at 5 p.m. or 6 p.m., even that, than ever do that again in my entire life. And, they actually took that on board. And it was removing the situation in a different way, but it's helped so many people going forward. And that was just writing an email. I guess as we're sort of working towards the end before we start getting into some questions from our audience, I wonder if we each have a message that you'd wish doctors in training take away from tonight's discussion about their mental health. For me, I am certainly going to take the boxes and the circles away. I think that's a really important point, and remembering when something changes from a want to a need. But Kim, do you have something that you'd like as a one message takeaway?
Oh gosh, I don't know how helpful that this is directly with regard to people's mental health, but I'm going to say it anyway. And can I say shit on this podcast? Because I think one of the most important things to take away is that shit happens and it's not always your fault. There's a lot more beneath that phrase than that it seems at that superficial level, but awful stuff happens to us as doctors, and we end up as being the container of it sometimes, and sometimes we blame ourselves for it, and sometimes it has adverse effects upon us. You've touched it a little bit earlier, I can't remember who said it, but implying, things like vicarious trauma and secondary trauma from all the things that have happened to our patients. We're not human if we're not affected by those things. We see and hear, unspeakable things sometimes, and the job is tough, and we need to recognize it for what it is. And I think my message is it's not any of our faults, and we shouldn't be blaming ourselves. And there are lots of shoulds, and we shouldn't say shoulds or would or musts or oughts, but we do blame ourselves far too often. And sometimes it is just what it is, and not to take it personally.
That's such a good message. I think that was perfect. And just to make you feel better, shit.
Okay.
Sabrina?
Oh, sorry. I guess for me, I think one thing that I learned throughout my own journey with my lived experience is that, one of the big fears I had was I had this period of identity crisis when I became unwell. What would it mean if, for me as a person, as who I am, if I wasn't a doctor? If I got so sick and couldn't be a doctor, what does it mean? And actually, over the years, I've kind of realized that being a doctor is only a small part of me. That there's a lot of other important things about me that's just as important as being a doctor. being a parent, being a sibling, being a friend, being a musician or an artist, all that's really important. And you are who you are as a person as a whole. So continuing from Kim, don't beat yourself up if you fall sick or if you struggle with training. You know, you're more than a doctor. You're more than, if you have an illness, you're more than that illness. You're a person who has family supports. There's people get better, you'll get better, and you'll keep the journey is going to be tough. If my journey was really, really hard to get to where I am today, but I got there in the end. But that's only, just like I said, only a small part of who I am as a person. So I think it's important to remember that.
That's such a good point. I often fall into the whole of I am only a doctor, and nothing else. But then I have lovely people in my life who remind me I have more things.
I know it's not my turn, but in the early years, whenever I would meet someone new, it would be like, "Oh, hi, I'm Dr. Jenkins. I'm a doctor," and that would be how I would put myself forward. It took me many, many years to present myself as, "Hi, I'm Kim," and then somebody would sort of like, "Oh, have you got a job?" "Yeah." "Oh, I'm a doctor." And to actually, and to actually put the me bit first and the doctor bit second took many, many years to get to that stage.
That's really
I've
cool.
never had that experience, Kim. I like to pretend I'm not a doctor, so no one asks me for help on a plane. That's my worst nightmare, someone asking me for help on a plane.
Oh, as a former trauma reg, that's my exact dream.
Being asked for help on a plane.
Absolutely. It's happened before and it's great.
Oh, no.
And Elise, do you have one message you would wish our attendees to take away today?
I'm going to be very naughty. I don't have one message. I have two messages. Just work with me. The first message is, for the love of God, get a GP. I feel like we've all reiterated the importance of this. Get a GP that you can go to just free on. I remember when I was unwell, my GP, I would say, like without exaggeration, saved my life. And she fit me in regularly for check-ins. She advocated for me to see a psychiatrist. And at one point she was like, "Elise, I really think you need to go to the hospital." And I was like, "Well, I'm not going to the hospital I work at, and I don't have private health insurance, so it's a no from me." And I feel like a lot of GPs would have given up at that point. But she was like, "Okay, let's work together for this. You're going to have a week off. Your partner's going to have a week off. I'm going to call you and check in." And she really went above and beyond to support me through that period. And, if we didn't have that pre-existing relationship, and if I didn't have that relationship with her where I felt comfortable to say what was going on, the whole experience and outcome could have been completely different. And then I think my second message is that we're always like the worst critics of ourselves, and I think we have so much self-stigma and, so many perceived barriers to seeking help. But like mental illness is so common, and I do a lot of work in the lived experience space, and I've never shared my story of having a lived experience and had someone come up to me and be like, "Oh, you're terrible, you shouldn't be a doctor," or "I'm going to report you to APRA," or whatever. People come up to me and they say, "Oh, thank you for sharing that. I've been through something similar," or "Oh, thank you for sharing. I feel like I can help one of my colleagues who's going through something similar now." I think we have these worst expectations of how we're going to be perceived for acknowledging that we're unwell and seeking help, and it's just not the reality.
Absolutely. That's such a good point. Reality and what we see as the worst case scenario, which is often what pops into my head, is not the same thing. Thank you all. We're going to move into the Q&A portion of this webinar. So if our attendees would like to submit a question, please do so through the Teams function. Otherwise, you're going to hear me ask questions, and that's a concerning thought for everyone. I do have one question. I'm not sure if it was an intentional choice by the organizers of this webinar, but I noticed you are all three psychiatry realms.
Of different incarnations, yes.
Yes. Was that in an intentional choice in recognition of you're all quite passionate about mental health and well-being?
I think we're just confirming the stigma that people choose psychiatry to work through their own psychopathology.
Oh, I don't know. I think we all choose our own careers for various reasons, that, you know, doing things that are meaningful to us. And I think if you do look at people who work in psychiatry, you will find, compared to other doctors, a higher proportion of people who've got their own lived experience of mental illness, or who have close family members, or have had a lot of had exposure to mental illness in loved ones or close friends earlier on, and overrepresented in our specialty.
Absolutely. Leon is one of our lovely attendees. He's raised a question. Any tips for supervisors who might occasionally support registrars or residents struggling with mental health concerns? Probably many don't wish to be seen as struggling to their consultants.
Sabrina, do you want to start on this one? I'll come in later, but have you got someone you're supervising at the moment, or are you?
Yeah, I've just fellowed, so I don't at the moment. I don't have someone who I don't have a supervisee at the moment, but I guess it's I'm not sure.
I might actually jump in.
Sorry.
Oh. I'll go fast and then we can trade. So I recently noticed one of the interns I've worked with across a few rotations has not seemed their self, and I've noticed them slipping where they would normally never make those sort of mistakes. I hate to say mistakes, but nevertheless. And so after work one day, I was sitting after our paper round, classically at 5 p.m. I let the other resident go, and I had a chat and said, "Are you okay? Is something going on?" And she said, "I feel so alone. My family's not here. I'm not going to see them till November. I love work, but that's all I have right now. I don't have any friends outside of work." And she's moved to this new place. And this is going to sound really silly, but I just invited her to the trivia night that I was going to after work. And she came, and she feels so much better. And that's potentially not an appropriate solution for everyone, but in that particular solution, that was my solution.
I don't know that we'd all have convenient trivia nights, but it sounds like it would be fun and things. In direct response to the question, I was going to say, as a supervisor, be aware of your own boundaries. You are there as a supervisor. Your role as somebody's supervisor is not to be their therapist. It's not to be their friend. But you do have a duty of care to the people that you're supervising. And at risk of sort of going back to my advanced care plan, if you've got one of your own, say, and you've had that conversation you had with the intern at your workplace recently, after that trivia night, I'd follow up with, right, okay, the trivia night's helped now, but what are you going to do that's a bit more sustainable at that now? Have a look at this. Have you got your own GP? If you haven't, here's a recommendation. And do you need to go and see your GP for maybe a mental health care planner, see a psychologist, have someone to talk to? So the resource list you've made for yourself may be very helpful if you're a supervisor, just to have that list of resources that you could point somebody who's struggling in that direction. But all of us, we're in medicine because we want to make a difference. Okay, we can accept that we're not going to cure everybody, but we're here because we want to ease people's suffering, and we want to ease the suffering of the people around us and our colleagues, but keep the boundaries. And the most helpful thing you can do is to point someone in the direction of an expert in their area, because while they may tell you a little bit about what's going on, you are not, as a supervisor, are going to have conflicts of interest all over the place if you know too much about somebody's personal life and get too much caught up in the quagmire of their problems.
Absolutely. We always follow up with GP appointments.
I would say, oh, sorry.
Nope.
Oh, I was just going to say, I've never really been in the position of supervising someone who I've needed to support with their struggles, but I think having been a registrar, experiencing my own struggles and feeling very much like I had to put on a facade to go to work every day and function as a human being, I think none of my supervisors or colleagues asked me if I was okay. And I think it would have actually been a relief to me if my supervisor would have sat me down and said, things don't seem like they're heading in the right direction. Like, is everything going okay? And I think that could have actually been a prompt for me to acknowledge things were worse than I was allowing myself to believe, and feel, I suppose, validated that someone else was recognizing that things aren't going so well, and maybe deconstruct a little bit of the denial that I'd built around myself at that time. And I think it is okay to have that discussion. And I think, like Kim says, obviously your role then is to direct people towards the appropriate supports rather than being their support. But I think you don't be surprised if the response is actually a sense of relief or gratitude, rather than someone feeling ashamed or like they don't want to be perceived as struggling. And I think something else that you can do that's really helpful is normalizing. I mean, 1 in 4 people experience a mental illness in their lifetime. Like, it's incredibly common, and I think more and more there's doctors like us who speak out about our lived experience, and more resources around that. So I think normalizing that experience for people and dispelling some of the myths around mandatory notification and just having the conversation is really important.
Absolutely. And I guess I'll say, I think both perspectives are super valid and important. And I guess both complement each other, and knowing your boundary is important too, but also being able to have that conversation, I think, is very important. And as a junior supervisor, I do think there is a particular role for registrars in being open in a way that they feel comfortable with, whilst also referring appropriately, in having those conversations with our junior staff. We're going to create junior staff who then become senior staff, who are able to have those conversations, which I feel really passionately about. But this is not my TED Talk. So Palmer has said, thanks everyone. So refreshing to hear other doctors talk so candidly about their mental health and their early warning signs. How would you suggest approaching a supervisor or director about your mental health, especially when you're struggling? Sabrina, maybe you can take this one.
Yeah, I guess it was really, really hard, because you kind of feel very, very vulnerable doing it. And so I do remember when I had my relapse, or one of my relapses, and I was at a point where I was just really, really sick, and in a very, very dark place, and was probably and could have not probably wouldn't have come out of it. And I don't know what prompted me. I just went to my medical director and said to him, and was just really candid with how I felt. And it was just, it's not easy. And I guess I guess what would help, what helps me with opening up with my medical director or my supervisor was that I was quite transparent from the start about my own health, and being quite open about it, no matter how hard it was to do that, so that they were aware and they were part of my safety plan, relapse prevention plan, I suppose. Yeah.
Absolutely.
Actually, I found it interesting. You said you went to your medical director, and I think of several instances where it is actually a bit easier to go to somewhere higher up the chain than your direct supervisor.
Mm.
It's
Yeah, I'm not sure why I didn't go to my supervisor, to be honest, but I think it was perhaps because my direct supervisor was, I think there's not so much a power difference in the dynamic between supervisor-supervisee relationship, but I felt for some reason safer to go to someone outside of that relationship.
Yeah.
Yeah.
And so often these days in our supervisor-supervisee relationships, the supervisor's responsible for end of term training reports that can
Yes.
actually, decide whether you progress to the next stage of training or not. And so again, can be this fear that if they know I'm not well, if they know I'm not that I'm struggling, I might not pass the end of term assessment, I might not progress in my training. And that can potentially be another barrier to you approaching your supervisor for help.
Absolutely. And Elsiard once, I'm sorry if I said that wrong, in the chat has said, one of my supervisors, when I told him after a long night shift, I feel like I'm not concentrating well, as if I am drunk. He said, we don't care, and continued his bad comments on my work. That's the kind of supervisors we got. I wonder if we have any comments about what that supervisor said.
I think we're all stunned, aren't we? I think supervisors like that need to be sort of weeded out, and it makes me think of a body of work I'm doing at the moment, which is actually, as well as devising training programs for the supervisors, is to put in structures for identifying and processes for, oh God, I'm going to say dealing with, I can't think of a better expression than that, supervisors that aren't up to scratch, and helping them become better supervisors. And in this case, gosh, talk about an empathy bypass.
Yes, like I do, like in where I work, there is someone above a supervisor that the trainees can speak to if they're having challenges with their own supervisor. So there's a supervisor, then there's the chief training supervisor, and then there's the director of training. And it's kind of like a ladder that as a trainee can go to, if they find challenges with their supervisors.
Absolutely. I've certainly had some challenges with supervisors over the years. And I guess the one thing I would say, I'm not going to try to say the name again, is that this is not you, this is them, their response is appropriate.
I think as well, it's important to find someone you do feel comfortable with. Like when I was having a hard time, again, back at the Royal Adelaide. Sorry if anyone's from Adelaide. And, my supervisor wasn't someone I really had a good connection with. So I didn't go into the deep and meaningfuls about my life. I was just like, here's a letter from my GP. I'm not doing on call anymore. we both knew what it was about, but we didn't discuss it. And I think we don't want to perpetuate stigma, but I think if there is someone else who's not your supervisor who you feel more comfortable talking to, you don't necessarily have to have the discussion with your direct supervisor. You can find someone else who might be more appropriate, more responsive to your needs.
Absolutely. No one else has a question yet, but I have a question. Something that I've often felt when I've taken periods of leave for mental health or other reasons even, is rebuilding my confidence again. And I guess I would wonder if anyone here has had the similar sort of experience and whether they've developed any strategies. My strategy is currently to go to Pilates a lot, which helps, but it doesn't always still make me feel great in the workplace for the first month or so after returning. Has anyone got any thoughts?
Yeah, I actually had that very similar, well, the exact experience, Tash. Probably about 18 months ago, I had quite a severe relapse. I was hospitalized for 2 months and had ECT and really struggled with confidence when I got back to work. One, because probably I still had lingering depression, that lack of confidence, low self-esteem that depression can bring. But also I had been off work for 2 months, a bit out of the loop. And I was anxious about, about another relapse, what's going to happen again? Is it going to happen again? So I guess what I did was actually had a graduated return to work plan. So I started off with working pretty much, I think, just half days, 5 days a week, and then bringing that down and then slowly increasing that to so that's what, 0.5. And I usually work 0.8 during that time. And I slowly built up my working, my hours back at work. And I was also very open with my supervisor at that time and said, look, I'm feeling like I've lost a lot of confidence in my performance. And my supervisor was unfortunately very supportive and was happy to take my 10,000 phone calls I had to him, like, am I doing the right thing with this patient? Because I'm so scared that, I just lost confidence in my clinical skills. And that took a while. Building back your confidence takes time because recovery takes time. It's not just the loss of symptoms in recovery, it's that loss. So when you recovery is not just about not having symptoms. It's about getting back to where you were or as close to where you were before you became sick. And that will take time for you to for one, the symptoms to go away, because mental illness, it's not like, oh, here, take a tablet and suddenly you're better. It takes weeks or months sometimes for medication to start working. Then it takes time for you to come to terms that you've been unwell, and then it takes time for your cognition to get back to where it used to be. So I think it's just about being really gentle with yourself in that period of time.
That's so, I'm really glad someone relates to that experience. It makes
Yeah.
a lot better. And those are some really practical strategies that you had to address it. So that's amazing. And that supervisor sounds fantastic.
Yes, I've been very lucky.
I do wonder if that sounds like a particularly lovely moments that you felt quite supported, but I wonder if in our own experiences, have there been any other moments or conversations that we've had that we've felt seen as a doctor? Because a lot of the time as a doctor in training, we can feel like part of the wall. And at least, have you had any moments that stand out to you?
Yeah, I think a moment that really stands out to me was when I was doing the job that I'm currently doing actually right now, about 2 years ago, and it's a psychiatry registrar role, flying in and out of Cape York and the Torres Strait, fly in, fly out, 1 week on, 1 week off, in community. And it's quite a demanding role because of the constant travel and the complex nature of the patients and the resource constraints of delivering care remotely, and you sort of have to be AODS and CL psychiatry and acute and community management and older person. So it was quite the cognitive load. And during the time that I was a registrar, we had constant locum cover. They couldn't have a regular consultant. And so every 2 to 4 weeks, I'd have another boss who was just filling in. And I felt like I was working really hard to be the consistent doctor on the team and provide the consistent care and have a sense of what was going on. And I was just exhausted by it all. And one day I was walking along the path in Thursday Island with one of the clinicians who's a psychologist, and she turned around to me and she said, "Elise, you've just been a real rock for the team during this time." And in that moment, I just felt like so seen and so appreciated that actually, my efforts weren't in vain. And, the team really valued what I was doing, and that, I was working to support them as best I could, despite the constant roundabout of locum consultant. So I think for me, that was a really nice moment, and a moment that really stuck with me.
That's so lovely. Kim,
Oh, hold on. I was going to say to Elise, hold on to that moment and write it and keep, I don't know, print it out or something and keep it in the good memories, good feedback box, because I think we all need one. And the thank yous, or you've done a good job, or you're great at what you do, we don't get enough of them. So the ones that we do get are worth keeping, so that when you've got you're not feeling too good, you've got your feel good box that you can go to and remind yourself that you do get it right most of the time, and some people do really appreciate what you do. So I'm sorry, that's a bit sort of pop psychology to say keep a feel good box, but I think I've got every thank you letter that I ever received, and it's funny just going back to them sometime thinking, oh, I remember that phase, that little card that somebody sent me was a lifesaver at that time, because that job was a horror job, and at least somebody appreciated it.
absolutely. One of my previous interns wrote me the most lovely card, and there's one line that I often look at. It's, "You are the registrar I would like to be one day."
Oh,
And I was like,
oh, yes.
okay, that's fine. Okay, don't make me cry. Well, thank you everyone for being here today. Are there any final questions for our amazing panel of speakers? No. I'm going to resist the urge. I'll keep it to myself. I might email you guys. You'll never know. Thank you everyone for attending, and thank you again to our amazing speakers. Now, if you enjoyed this, I've got to say, you're going to really enjoy the AMA 26 National Conference. I've got to say, there's a really amazing conference convener. It's currently on sale. It's going to be in August in Melbourne, so be nice and warm. DITs will receive a discounted rate to attend, and all passes will include a complimentary ticket to the gala dinner. It's pretty cool. Over the next week, AMA will circulate a post-event survey and the session recording for you guys to reflect back on. We really encourage everyone to respond to the survey. It's how we are going to make better events and greater events in the future. Thank you, everyone.
An extra question's just snuck into the chat.
Oops. Hayat, what is everyone's experiences with occupational health assessments with returning to work after a period of extended leave?
Well, I do remember when I had my first relapse when I was a first year registrar. I had to go through the occupational health and safety department, and they made a plan that, this is what you're going to do with your graduated return to work plan. The other thing was that they also so that plan was given to not just my supervisor, but also the director of the service, to make sure that that plan was appropriate for me. And then I had regular meetings with the OHS person to make sure that I was traveling okay. Occupational health assessments with returning to work at a period of I guess one thing that I'm not sure whether this will answer the question, but it popped into my mind. It reminds me of when I had to navigate APRA, and they required health assessments for me to return to work, or after a period of leave. So my story with APRA is that I self-reported to APRA that I had been unwell, and they actually like that because they know that you are actually mitigating your own risk. So I didn't have a massive restriction, or I just had conditions on and the conditions were that they wanted reports from my psychiatrist and my psychologist, and a clear working plan for myself as part of my return to work. So that was my experience around, occupational health assessments, that my psychiatrist and my psychologist had to see me regularly and write a report back to APRA after I went, to make sure that I was okay when I returned to work from after a period of being away from work.
That was really interesting to hear. I saw the question and I didn't know what an occupational health assessment was outside of post-seizure return to work.
I think the answer to what one is may well depend on the jurisdiction in which you're living, and it's hard to answer that question across the whole country. I know we were sort of winding up, but when I was working at the Doctors' Health Programme, I don't think this service exists anymore, and I can't speak on behalf of the Victorian Doctors' Health Programme, but one of our roles was in coordinating return to work programs for doctors who had had a period of time away from work for mental health problems or for substance use problems. And our role was very much to act in a sort of middleman, liaising with the workplace and knowing about what the job entailed for the person, and being able to sort of have a foot in both camps, advocating for the doctor in the workplace, with having this extra understanding that being another medical practitioner brings, of what the workplace was going to demand of that doctor when they went in. And we would bring together the wishes of the doctor themselves, their carers, their own psychiatrists and psychologists, and be that sort of mediator between the two in order to get a really appropriate return to work plan. And I think, going back to that previous question of rebuilding confidence, it's do it slowly. As Sabrina said, it takes a while to build up. And the last thing you want to do is just jump in the deep end and fail. You need to build up and have lots of wins along the way.
Well, that was a lovely way to wrap up our conversation. Thank you, everyone. Thank you, attendees. Thank you, speakers. And thank you to the AMA team who helped organize this.
Thank you.
Thank you
Thank
so much,
you.
everybody.
Goodbye.